Ultrasonography of the inferior vena cava. In this video, we'll show you how to perform an ultrasound scan of the inferior vena cava, which we'll refer to as the IVC from now on. The most common reason to perform a point-of-care scan of the IVC is to assess volume status. We'll talk about that a little later, but first, we'll go over the basics of how to perform a scan. The abdominal IVC is retroperitoneal and closely adjacent to the aorta. To assess the IVC, we first scan in the short axis, or transverse plane, and center the vessel on the screen. We then rotate to the long axis, or sagittal plane, for a longitudinal view of the IVC. We can use a curvilinear or phased array probe for these scans. Short axis view. Place the probe just under the xiphoid process with the probe indicator pointing to the patient's right side. Pushing the probe down firmly can improve the image by displacing any overlying abdominal gas. You can now clearly make out two anechoic structures lying just anterior to the hyperechoic vertebral body and its large acoustic shadow. To the left of the image, just to the right of the patient's midline, is the IVC. To the right of the image, just to the left of the patient's midline, you can see the abdominal aorta. The IVC has a thinner wall than the aorta and can usually be compressed quite easily with the probe. In contrast, the aorta is thick-walled and almost impossible to compress, remaining circular under the probe. It also pulsates much more noticeably than the IVC. Long axis view. The easiest way to obtain a long axis view of the IVC is to obtain the short axis view first and then transition. To do this, center the vessel and then rotate the probe 90 degrees until the probe indicator faces the patient's head. Alternatively, you can go directly to the long axis view. Place the probe just under the xiphoid process with the indicator facing the patient's head. Now, slide or fan the probe very slightly to the patient's right until the IVC is visible. Here, you can see the IVC in longitudinal section at the lower edge of the image. The arrows illustrate the direction of blood flow from caudal to cranial. You can sometimes see subtle cardiac cycle-related pulsation of the IVC. You should also be able to see respiratory variation in the IVC's diameter, which normally partially collapses in inspiration. To measure the IVC diameter, freeze the image, then take measurements at peak expiration and inspiration. Use the caliper or measurement button to draw a line at a right angle to the vessel's long axis. You can measure either just distal to where the IVC enters the right atrium or 2 centimeters proximal to the junction of the IVC and hepatic vein. A large diameter and reduced respiratory variation may suggest volume overload or increased right heart pressures. A small diameter and increased variation, on the other hand, may suggest volume depletion. Okay, now that you have an overview of IVC ultrasound skills, check out the POCUS article on AMBOSS.